COVID-19 has captured the world's attention as the most urgent health battle, but it doesn't mean that less attention should be given to other threats for disease outbreaks. In Belize, with our weather, we also must remember to maintain vigilance for outbreaks of dengue.
There tends to be two spikes throughout the year for dengue. We tend to see a very early spike in the first quarter of every year, and then things tend to taper off, and then we don't see a second spike, which would be the main transmission season occurs somewhere around between May and November.
So that means right now, we should start to see an increase in dengue cases. It may be hard to recall, but last year, Belize battled a massive dengue outbreak with over 8,000 cases and about 10 fatalities. According to the Pan American Health Organization, in 2019, the Americas reported more than 3 million cases of dengue, the largest number recorded in the region so far.
Globally, you had the highest record ever number of cases. That included Belize, which saw record-breaking numbers last year as well. Around February, we had a regional bulletin from PAHO advising us that it seems that the trend will continue for 2020. And at the time of their reporting, up to the first 8 weeks of 2020, most neighboring countries had seen a 2 to 3 times increase for the same period in 2019.
But so far, it seems like COVID-19 may have brought with it an unexpected silver lining, in that in Belize, we haven't seen the same type of increase in the number of cases of dengue. Health officials believe this is because the country was beginning its phased shutdown.
The lockdown helps because there's less persons moving from one district to the other, persons from endemic areas going to non-endemic areas, and lots of factors, but primarily those two things.
So for now, the cases have been concentrated in what would usually be your hotspot areas.
Yeah, you look at the data we shared, 66% of the cases this year being identified in Corozal and Oranjewak districts. And those could be narrowed down to specific areas within those districts.
So what happens now that movement restrictions are loosening?
We've been discussing that internally amongst the management team, and definitely the whole COVID-19 situation had an impact in terms of how we execute and carry out services to the general public. There was, for almost 2 months, basically no field activities in terms of house-to-house inspections and things like that. So it definitely had an impact. But as of, I believe, a little bit over a week ago, we're kind of reverting back to our routine activities.
So the usual call for dengue prevention commences. Clean your yard. Ensure that there are no vessels or garbage collecting water, as these can be breeding grounds for mosquitoes, even those backyard kiddie pools. And even though we are in a pandemic monitoring COVID-19, the public must also be on the lookout for the early signs and symptoms of dengue.
I think one of the key messages that we want to get out is that we have grown to sort of live with dengue over the years, and many persons have basically passed these episodes and take it as just maybe, oh, I have a common flu or a little cold or something like that. But we have seen whereby there's a short window, 24 to 48 hours, where either you recover or you take a turn for the worse. And that is one of the things that we saw last year with some of the fatalities that we had. You come down with the classic symptoms, fever, headache, chills, body aches. You need to seek healthcare at the nearest health facility.
While we may not be seeing record-breaking numbers as yet, it is still an urgent situation that we must all be carefully monitoring.
And you can bet your dollar that when the forecast and the epidemiological modeling and the disease modeling and those things are done and they present it and tell you that it's going to be an active year, more than likely it's going to be an active year. And we saw that last year, and that's just carrying over to this year. So I think we have a few things going to our advantage in terms of the border being closed. The curfew has helped as well. Persons being locked down during peak mosquito biting periods, which tend to be between 6 and 9 o'clock at night. So that also plays into our favor as well. But we can't take it for granted that that's going to be all that we bank on. And we also can't take it for granted that we need to rely on the Ministry of Health only to do their part. I think we side with the experience with COVID-19. It's a shared responsibility in terms of public health, and the same applies to vector-borne diseases like dengue.